Hello, everyone. Welcome to another episode of the Anti-Pharmacist podcast. I hope you enjoyed your weekend and I hope you have listened to my TGIF episode. It was a very interesting one. So, please do listen to that. Today, I'll be starting a series that I call the drug use series, alright? I'll be talking about drug use in different stages of life, alright? Because there are some special conditions in which drug use is quite delicate. Conditions like pregnancy, like in children, like in elderly, alright? So I'll be starting today with the drug use in pregnancy, okay? And this is a series that will lead me to my 50th episode, alright? Because I call it the road to 50. I am really excited to share with you that this podcast has been going strong from the inception, from the first episode, even till now. This is our 47th episode. So we have just 3 episodes to 50 episodes, guys. That's a lot of work, and thank you so much for your encouragement so far. So without further ado, let me just get right into today's episode. Okay, so pregnancy is a very critical aspect of a woman's life. You see, a lot of things happen to a woman's body during pregnancy, and some people even argue, especially in the medical field, that pregnancy could be considered a disease condition because it's like a departure from the normal physiological condition of the body. There are cases in which there are some diseases that a woman develops during pregnancy, which they would not have had normally if they were not pregnant. Examples like nausea, vomiting, some GI disturbances, constipation, and all of that. Some people even come down with gestational diabetes, gestational hypertension, thromboembolism, and all of that due to the fact that they are pregnant. Some infections too can come in, like bacterial, fungal infections, due to reduced immunity of the woman during pregnancy, because they have to actually pass some of their immune cells to the baby in order to protect it. So a lot of things happen to a woman's body. The hormone levels fluctuate. Some are in very high quantity, others are in low quantities at different points in the pregnancy journey. So a typical pregnancy lasts for 9 months or 40 weeks, as the case may be, and it is usually divided into trimesters. The first trimester lasting from the first day of the pregnancy to 3 months into the pregnancy, or about 12 to 13 weeks, alright? And the second trimester lasting from that 3rd month to the 6th month, while the 3rd trimester lasts from the 6th month to the 9th month, in which birth is expected under normal circumstances, alright? So a lot of things are happening to the woman and to the baby at the same time during this period. The first trimester is usually the period of fertilization and implantation, where the zygote is formed before it starts growing into a fetus. A little of organogenesis starts. Some organs they start developing. From second trimester, there's major organogenesis. Many parts of the baby's body start developing at this point. Then the 3rd trimester, the final formation, of the baby happens in 3rd trimester. And because of all of these things happening, pregnant women are very sensitive to medications. Medications should not be used indiscriminately by pregnant women because of this. So there are medications that are contraindicated, that it should not be used at all, and there are some that can be acceptable based on the risk-benefit ratio. So it is very important that if you're pregnant and it is not showing yet and you require some medical attention, please always let your healthcare provider know that you are pregnant, no matter what it is that you are treating. If it's a doctor, of course, maybe they would carry out tests to know if you're pregnant or not. And some may not. If it's a GP, please let them know if they're not the ones that discovered it in the first place. Or if you're going to a pharmacy, for example, you are complaining of headache, constipation, please let them know that you're pregnant. This is to protect you and your child, alright? This is not the era of, I'm pregnant, or nobody must know, so that and no evil eye will look upon me. No. If it's your healthcare provider, the only reason they need that information is for your own good, it's for your benefit, to know which medications that are tolerable or allowable for you and which ones you can't take, because there are different categories of drugs in pregnancy, which I'll be explaining right about now. The FDA, which is the Food and Drug Administration in the United States, which is like the standard authority on medications worldwide, has categorized medications into different categories based on their risk to the pregnant woman and the baby. Alright, so there's category A, there's B, there's C, there's D, there is X. Okay, so category A medications are medications that are generally acceptable and safe in pregnancy. They have been used over time and have been ascertained to not affect pregnancy in any way. You see, the major scare for pregnant women is the risk of teratogenicity. The medications could affect the development of the baby. I've mentioned different stages in which the baby develops over the period of gestation, that is pregnancy. These medications could interfere with one or two of these stages. That is why medications are not advisable to be taken indiscriminately by a pregnant woman. It's been discovered that category A medications, upon adequate studies in humans, have demonstrated no risk at all to the fetus or to the mother. Category B medications now, based on animal studies that have been done, there has been no risk discovered, but still there are no adequate studies in humans. Okay, it's difficult to carry out some clinical trials, especially those in pediatrics, in pregnant women, because clinical trials are to see how medications react in humans, both healthy and unhealthy, the ones with the disease in question. But because of ethical reasons, clinical trials cannot be carried out on pediatrics and on pregnant women, at least to the best of my knowledge now. If it's being carried out, it must be under strictly controlled environment, and it cannot capture a wide range of population. So most times, experiences and animal studies are what are used to judge and present medications to these groups of people, because they are special population. So it's based on these experiences and studies in animals, based on adverse reactions that have been reported in the past. You see that these categorizations have been made. I have mentioned category A, which is fine for humans, category B, in which animal studies showed no risk, and there are no adequate studies in humans. So since there's no adverse effects from animal studies, it is still very important to monitor the use of this medication, even in pregnant women. Alright, for category C, there's a potential risk, okay, because animal studies have been performed and there have been some adverse effects noticed in some animals, but there are no data at all from human studies. So they may be used when potential benefits outweigh potential risk. Like I mentioned earlier, what we actually weigh is the risk-benefit ratio. If we give this medication to the mother, will it harm the baby? If we don't give it, will the mother die? Will it be better for us to give it to the mother, even if the baby will be harmed or may not be harmed? At least the mother will survive. Do you get? And have another pregnancy, hopefully. All those things. Those are the judgments that have to be made before medications are deployed in pregnancy. Now to category D, there is clear evidence of human fetal risk. That is, these drugs have been known to be risky in pregnancy. They have been known that they cause a kind of adverse effect on the fetus, on the child, on the pregnancy. But potential benefit to the mother may still be acceptable, especially when the case is fatal and the life of the mother is priority. You can still give it, even if it will harm the fetus. Alright. Then there's category X. These ones, studies in animals or humans have shown adverse reaction, and there have been documented fetal abnormalities. I talked about teratogenicity earlier. This could manifest as developmental abnormalities or even physical deformities. Okay. There have been medications in the past that were wrongly administered to pregnant women that caused them to give birth to abnormal children. You see, this is different from genetic abnormalities. Of course, some of those are due to exposures to adverse substances, all right, but a case of thalidomide, for example, and it caused deformities in children with no limb, with cleft lips and all of that. So the risk of use in pregnant women clearly outweighs any possible benefit. So this category X medications should not be given at all. I've given you the categories of medications, right? Let me now match commonly used medications to these categories. The first, analgesics and antipyretics. They could be in categories B and C. Paracetamol is an analgesic, acetaminophen, it's in category B. Aspirin and NSAID is in category B, alright? Then antiemetics, that is anti-vomiting. We know that nausea and vomiting are very common in pregnancy, especially the first trimester. They can be in categories B and C, depending on which one. Then antibiotics can belong to category B, C, and D, depending. Example like penicillin, ampicillin, amoxicillin, they're in categories B. Cephalosporin and erythromycin as well, they're in the B category. Metronidazole as well is in B category. That is, they're acceptable because there are no adverse events that have been recorded, no harm to the fetus. But the likes of gentamicin is in category C. Streptomycin and tetracycline are in category D. Once you give it to the mother, there's a high risk to the fetus. Do you get? But you must only give it when you are sure that there's no other option and the mother actually needs these medications. That is the streptomycin, the tetracycline. Now, going to anti-malarial, antifungals, those are in category C, as well as some anti-tubercular agents like ethambutol, rifampicin, pyrazinamide. They're in categories B and C, alright? While vitamins, all vitamins majorly, the B, C, D, E, and folic acid, they are in category A. That is, they're acceptable generally. Of course, you know, in pregnancy, there are routine medications that you take. The likes of your folic acid, the likes of your B complex. These are given routinely for the benefit of the fetus to prevent neural tube defect. Because the body itself, the human body, does not have the ability to produce folic acid. And there is a recommended daily average that is needed for the fetus to grow normally, which may not actually be gotten from our meals. That is why the supplementation is important. So when you're pregnant and you go for your antenatal and they give you these medications, don't think, maybe they said they should not be taking drugs in pregnancy, so why are they giving me this? And you know, most pregnant women have the problem of nausea, vomiting in first trimester, so they can give you some antiemetics as well. Folic acid is usually given from the first month, if possible, of pregnancy throughout pregnancy, because it is very important in the development of the fetus. You know, folic acid constitutes part of what is needed for DNA synthesis and for brain development in fetus, okay? And the anti-malaria sulfadoxine pyrimethamine is actually given from the second trimester, and it's usually given 3 times in the course of pregnancy to prevent malaria, which pregnant women are very susceptible to and which could cause a lot of abnormalities like miscarriage, like low birth weight in the baby once the child is given birth to. So these are 2 major medications that you should not miss during pregnancy. You see, so those are medications that are actually tolerable in pregnancy and you have to take them. Your ferrous as well, you know, because a lot of women come down with anemia during pregnancy and it is not good for you. You know, your blood is what you actually need to be energetic. It transfers oxygen around your body and nutrients. So that's why you're given these medications to take. But then there are supplements that actually combine all of these in one for pregnant women. If you can't afford those, why not go for them? You see, so those are actually very safe in pregnancy. But before you take any medication at all, you know that you have to talk to your healthcare providers, right? Yeah, so that's it about those. Now I'll be going to particular medications for some diseases, because there are diseases that come with pregnancy, although not in all pregnant women, but majority of pregnant women have these diseases once they're pregnant. And of course, they have to take medications, right? Because the health of the mother is also very important, as even the health of the child depends on that of the mother. Okay, so I'll be talking about a few pregnancy influenced issues or pregnancy induced diseases, like those of the gastrointestinal tract, the likes of constipation, hemorrhoids, nausea, vomiting, gastroesophageal reflux disease, that peppery feeling in the chest. You feel like throwing up when you eat some kinds of food. That is gastroesophageal reflux disease. Then there's gestational diabetes. There is hypertensive disorders in pregnancy. There are thyroid abnormalities, and there is also thromboembolism. There are also bacterial infections, which I've hinted earlier, as well as fungal infections. Some women actually have more yeast infection during pregnancy, and this is because of the reduced immunity, like I've told you. So for the GI tract, constipation, for example, occurs in about 25 to 50% of pregnant women, and the first line treatment are bulk forming agents like your methylcellulose, your psyllium, and osmotic laxative like your lactulose or your PEG, polyethylene glycol. All of these, of course, you find when you go to your healthcare providers to complain about these things. They know which ones to give you. But I'm mentioning them to you so that you can know which ones are beneficial to you. Somebody might just give you that, take this one. It's something that I used when I was pregnant. They might just have been lucky for it to not affect them. What if it affects your own child? So you should be very careful. When you're pregnant, it is advisable to not even use any medication without the go-ahead of your healthcare provider, because if possible, it is very good not to use any medication during pregnancy, except absolutely necessary. You see, second line treatments for constipation, the likes of your bisacodyl, okay, and those that are contraindicated are castor oil, for example, because it could stimulate uterine contraction, or mineral oil like your liquid paraffin. You should not use those, even if you're constipated and you have them at home. They're not for you as a pregnant woman. For hemorrhoids, majorly the medications for hemorrhoids are tolerated because most of them are laxatives, and I've mentioned laxatives earlier. For your constipation, you can use those. Then topical agent like your suppositories, those ones will not really be absorbed, so you don't have a problem with that. You can use those. Then hydrocortisone cream to reduce inflammation and itching around the anal region. You can use those too. They're fine in pregnancy. For your GERD, what you need is actually antacids. Okay, antacids contain aluminium, magnesium, and calcium preparations. You see, and they are not absorbed. They only dilute the acid in your intestine. Okay, so you don't have a problem with absorption. It's when you absorb medications, you see, that they could actually cause some reactions in your body. Lest I forget, during pregnancy, some changes happen to medications in your body. Like a normal person that is not pregnant now, the rate of absorption, the rate of distribution, metabolism, and excretion of medications is different from that of a pregnant woman. Absorption, for example, is reduced in pregnant women because of reduced gut motility. We have talked about constipation, which happens in pregnancy. Metabolism as well, liver enzymes, they are produced in higher quantities during pregnancy. So medications are eliminated earlier in the body of a pregnant woman. So the medications may not actually have a good duration in the body for them to actually work, and therefore you'll be needing higher doses, which in turn may be toxic to the fetus. Another one is the excretion or elimination. Most of the excretion of medications happen in the kidney, and now in pregnancy it has been shown that the glomerular filtration rate is about 100% increased during pregnancy. So drugs that are excreted in the kidney, they are eliminated faster, and this may lead to reduced therapeutic outcome as well. So you see that in pregnant women it is different. You should not just take medications indiscriminately. Now, for pregnant women with serious cases of GERD, H2 receptor blockers like your cimetidine are fine, okay? They could be very useful for you. Proton pump inhibitors should not be used indiscriminately, okay, without the go-ahead of your healthcare provider. I'm saying all this because before pregnancy, you could have been using these medications, and especially for your chronic illnesses, maybe. And once you get pregnant, you might think, since I'm using them already, let me continue using them. It may not be the case. For example, now, for hypertension, there are some people that have high blood pressure even before pregnancy, even though approximately 10% of pregnancies come with high blood pressure. If you did not have high blood pressure before pregnancy, of course, your healthcare provider will give you the appropriate ones, the likes of metildopa, your labetalol, your hydralazine. Those are the ones that are tolerable in pregnancy. But for those that have had this condition before pregnancy and you have been using a kind of medication, once you get pregnant, please let your healthcare providers know so that they switch you to the appropriate ones. The likes of asthma as well. Your inhaled corticosteroids could be fine. Your inhaled beta-2 agonist could be fine. Your Seretide, your Ventolin. But when it comes to the oral, you have to be careful because you can't just use corticosteroids like prednisolone like that in pregnancy. It could be very, very dangerous for your fetus or for your baby, except you have very serious cases. And this will be given to you and you'll be monitored by your healthcare provider. Serious monitoring, okay? But for those that take the likes of theophylline, or there's a theophylline combination in the asthma medication, like the people that take Franol or Asmanol, you have to discontinue it because it is very dangerous for your fetus development. Now I'm going to diabetes. For people that have had diabetes before pregnancy, your oral antidiabetics could still be good for you, as well as your insulin. But of course, do take these things with the guidance of your healthcare providers. Also, for thyroid abnormalities, this happens in like 3% of pregnant women, even if they have not had it before. Hyperthyroidism is one, then there's hypothyroidism. Hyperthyroidism is associated with fetal death, low birth weight, preeclampsia, that is pre-hypertension in pregnancy. Then hypothyroidism, if untreated, could also lead to preeclampsia, premature birth, and miscarriage. So they are treated with appropriate medications like propylthiouracil for the first trimester and methimazole second and third trimester. That's for hyperthyroidism. Then what is contraindicated is iodine because it could damage the thyroid of the fetus, so it's not given, it should not be taken. While for hypothyroidism, thyroid replacement is fine. With levothyroxine, it is tolerated. Now for thromboembolism, the risk in pregnancy is 5 to 10 fold more than those in non-pregnant women, and low molecular weight heparin is used throughout pregnancy, even up to after 6 weeks after delivery. Okay, you should avoid warfarin, especially in your first trimester. Now for infections, acute conditions in pregnancy like your urinary tract infections, your sexually transmitted infections. I've given examples of antibiotics and anti-infectives in different categories, the B's and C's. Most of them are in between B and C, so you can't even take these medications without them having been prescribed by your healthcare providers in the first place. Okay, then for headache, paracetamol, acetaminophen, and NSAIDs generally are not really acceptable in pregnancy because of that inhibition of prostaglandin, which could affect your baby, because prostaglandin does a lot of things in the body. It's a very, very important substance in the body. Okay, so you can't just take NSAIDs indiscriminately, even aspirin, because it could cause some fetal abnormalities, some developmental abnormalities in your fetus. Okay, ibuprofen is the only NSAID that you could use apart from paracetamol, and that's if the headache is not controlled by paracetamol, but your first choice should be paracetamol. Now for those that have migraine, for example, sumatriptan could be safe. Okay, don't take Cafego, that's ergotamine. It could cause uterine contraction and that could lead to miscarriage. Okay, for malaria, uncomplicated malaria can be treated with quinine and clindamycin. That's for first trimester. And for second and third trimester, you could use your artemisinin derivatives that have been proven to be safe. Okay, please do not use doxycycline during pregnancy. It is contraindicated. It has some anti-malaria properties, you see, and it's also an antibiotic. Doxycycline is in the tetracycline class, and I mentioned that those are in categories C and D. they are not safe in pregnancy, especially for your fetus. Okay, so you could use that. I could go on and on and on. There are many conditions for which there are specific medications that are safe in pregnancy, while others are not. Okay, but the long and short of what I'm saying is that during pregnancy, please carry your healthcare provider along. Whatever drug you're using, it's possible that you've been on a drug for a chronic illness before pregnancy. Don't assume that you should continue in pregnancy. Alright, let your healthcare provider know. Don't just go and refill like that. It's possible that you've transferred your care. Maybe before you got pregnant, you were in another state and your doctor was familiar with your condition. Then you went to another state now and you're pregnant. Let your healthcare provider know your history. Okay, as a pregnant woman, it is very important because this could impact whatever it is you take in. Even food could impact your baby and you in the long run. And that is what I brought to you today on the Anti-Pharmacist podcast. I want to believe that you should have questions concerning this episode. You see, so I'll be waiting for them in the comment section. You can also give your comments, about your experiences during pregnancy, the kinds of medications that you were even shocked to know that you cannot take in pregnancy, alright, or those that you were shocked to know that it's actually safe in pregnancy, contrary to popular opinion, alright. And please make sure that you share this podcast with as many pregnant women as you know, or as many people as possible, because at a point in your life you might know somebody who will be pregnant, either you're male or female. And if you're female, you're not even pregnant yet. At a point, you'll get pregnant, right? If you're planning towards it, in fact, you should listen to this so that you can be better prepared. So, on that note, I say thank you for listening up to this point, onto this episode of the Anti-Pharmacist podcast. Do not forget, please subscribe, share, like, follow this podcast, and please engage us on all our social media platforms, on IG, on X, on LinkedIn. Okay, I'll be waiting for your comments, for your questions, and all that good stuff. You can also contact me for collaborations on my email via antipharmacistpodcast@gmail.com. So thank you so much for listening. I'll be bringing another drug use series to you next week Monday. Till next time, stay healthy and God bless.